AmbioDisk amniomembrane contact lens for patient with persistent non-healing keratoepithelial defect. This is Dr. Ming Wang from Wang Vision 3D Cataract and LASIK Center, Nashville, Tennessee, United States. I'm going to describe the clinical protocol of how we place AmbioDisk amniomembrane contact lens for a patient with persistent non-healing corneal ulcer. AmbioDisk amniomembrane procedure with a CPT code of 66778 for non-surgical fixation of amniomembrane is indicated for a wide range of anterior surface disease, including corneal ulcer, corneal scar, corneal degeneration, recurrent corneal erosion, and corneal dystrophy. These are all the diagnostic codes that crosswalk with the CPT code, procedure code 66778. AmbioDisk amniomembrane contact lens based on our US patents, and the membrane contact lens can be ordered from IOP company, and it's a 15mm disc with 35mm thick membrane. Here we open the Ambio dry box and take out the package, and within this package amniomembrane is situated. And the package comes with an 18mm square lens. This is the 18mm square lens bottle. We open the bottle and take out the 18mm square lens. And the amniomembrane has been engineered in such a fashion that when it sits on the underside of the 18mm square lens, it does not actually move, thereby forming a complex of amniomembrane and contact lens complex. So here is the amniomembrane from the package. You remove that. Make sure the ROP, the words ROP read correctly to you. And you put the amniomembrane on the underside of the 18mm square lens. Again, the square lens is 18mm and the amniomembrane AmbioDisk is 15mm. Here we have it, AmbioDisk amniomembrane contact lens complex. After numbing drop, you put the AmbioDisk amniomembrane contact lens onto patient's eye without having to use any lid speculum, and using wax cell to tap it in to make sure the amniomembrane contact lens sits well. This is a patient that's post-cataract surgery with persistent non-healing corneal ulcer due to stem cell deficiency, and with a history of a hepatic infection causing neurotrophic non-healing keratoepithelial defect. Here you see the amniomembrane contact lens in vivo has been placed onto patient's eye and situated very well. Typically, we leave the amniomembrane contact lens in the eye for 2 weeks. So again, this is Dr. Ming Wang. I have described the clinical protocol of using AmbioDisk amniomembrane contact lens for persistent non-healing corneal epithelial defect. AmbioDisk amniomembrane contact lens carries a procedure code of 66778 for non-surgical fixation of amniomembrane. And the reimbursement on average in the United States is about $1,500 for this in-office procedure. The diagnosis codes that crosswalk with the procedure code 66778 include a wide range of ocular surface disease, corneal ulcer, corneal scar, corneal degeneration, recurrent corneal erosion, and corneal dystrophy. AmbioDisk amniomembrane contact lens is based on 2 US patents that we have. And the AmbioDisk can be ordered from a company named IOP, and when one orders, the cost is about $600 and change, and the part number is AD5150 Ambio Dry 2 with 15mm disc and 35mm thick. They are a version of over 100 micron thick, actually 35 micron thick. 100 micron thick, that's too thick. So generally 15mm disc and 35 micron thick, that's the best option, and that works best with the square lens. Now the LP has come out with a new AmbioDisk of 9mm disc, smaller, than the 15 millimeter traditional size, which is used to cover specific area of ocular surface disease. And as I said, the package comes with an 18 millimeter square lens. And the clinical protocol of placing AmbioDisk and AMCL, including we put bilateral lower plug, collagen plug, and after the AMCL is in the eye, laude max gel BID, Besivan 3 times a day, Prolensa once a day for 2 weeks. And then we have patient come back from a separate visit, and typically for separate visit for the AMCL placement itself. And at that visit, typically we do not bill for the visit. Then we have patient come back in 2 weeks, and typically the amnion membrane would have dissolved by then underneath the contact lens. And in 80 to 90% of these cases, we found the persistent corneal epithelial defect healed. And overall, AmbioDisk amnion membrane contact lens has offered a powerful new tool for us to treat a wide variety of ocular surface disease. This is Dr. Ming Wang from Nashville, Tennessee, One Vision Cataract and LASIK Center. Thank you.